Good afternoon, everyone, and welcome back for our third video on safe sleep. So I'm just going to share my screen again so you all can see. So our third video today on safe sleep is on breast and bottle feeding in particular. So we're going to start off and discuss breastfeeding. So breastfeeding is the best way to feed your baby. There are many great benefits of breastfeeding, such as helping to protect your baby from sudden unexpected death in infancy, which is also called SUDI, including sudden infant death syndrome, which is also known as SIDS. So with breastfeeding, the research and science indicates that it actually can lower the risk of SUDI by more than half, which is a huge amount. So scientific research suggests that breast milk contains important substances that boost a baby's immune system and their brain development. So there are many benefits of breastfeeding. Some include helping your child to grow strong and healthy and can lower risks of illnesses and infections. It can help with food intolerances and digestion, and it can also promote physical and neurological development. So, of course, we know that not all children are only fed through the breast, that they also can be bottle fed as well. So, Red Nose Safe Guidelines gives consistent information and recommendations that allowing a baby or child to go to sleep with the bottle in their cot or their bed is not good practice. So I've put these two images here as reference of what not to do. So this is not what we want to be seeing in your service. The child in a cot or in a bed should not be holding their bottle and feeding themselves to sleep. It should not be propped up on any toys or pillows or comforters of any sort to enable them to feed, and the bottle should not be left in their bed at all. So it is not recommended for babies to have a bottle when being placed to sleep, as I just mentioned. There are also concerns about the child vomiting when asleep after having a bottle, and Red Nose would not recommend either using a pillow in a cot to prop a bottle up for the baby feeding, as this may cause the baby at risk of suffocation. So again, as discussed also in this picture, we wouldn't even just place them on their back and then feed them in their cot. That is not good practice at all in your services. So with bottle feeding and breastfeeding, settling babies to sleep with bottles of milk can lead to early childhood tooth decay. It has been recommended by Red Nose that the baby or child isn't settled in bed with a bottle of milk. If the child does need extra fluids, please just give them a quick drink of cooled boiled water before you put them into bed. So babies who fall asleep whilst bottle feeding can draw liquid into their lungs. They might then choke on it or even inhale it. So just a few safe recommendations just to go through with you. So while Red Nose recommends breastfeeding as the best source of infant feeding, obviously we recognize that this is not always an option for parents. So safe recommendations for bottle feeding include feeding the child the bottle of milk before they are due to sleep, to not allow the child to hold their own bottle and drink whilst in their cot or bed. No liquids at all around around the baby or child sleeping, obviously due to the child or the baby vomiting or choking whilst asleep after having a bottle. And again, mentioned, do not use any pillow in the cot to prop up a bottle for baby feeding, as this can cause suffocation. So I just want to strictly say, like, the best practice is just to ensure that no bottles of milk, water, or any liquid are present with the child in their cot or in their bed. And again, I just want to mention as well that if you are having parents and carers coming to you and saying that this is what they want you to do in your service, you just need to remember to refer back to the Red Nose guidelines, mention our services policies and procedures, and just go through with them and explain the best practice of what to do in your care. Because at the end of the day, it is your responsibility when you are taking care of their child that you are doing the right thing. So thank you for joining us for our third video, and we will be back soon for our fourth and final video for Safe Sleep.